Hello, thank you for taking time to learn more about improving postpartum care in North Carolina, tools and support for change. My name is Sarah Verbeest, and I am one of the partners on the fourth trimester project here at the University of North Carolina at Chapel Hill.
Hi, my name is Rachel Yep, and I'm one of the research associates on the fourth trimester project as well, and I am a nurse by training.
Thank you. Excellent. We want to start by thanking our funder. Our work is supported by a grant from the Health Resources and Services Administration Maternal and Child Health Branch. So just to take a minute to tell you just a little bit about the fourth trimester project. We are based at the University of North Carolina at Chapel Hill. It's part of the Collaborative for Maternal and Infant Health. Our work represents a collaboration across many different professionals, community leaders, and new parents from across North Carolina. And we're so grateful for them and for all of the energy that they contribute to our collective work. We also are really working to center the voices of women of color so that all mothers are seen, heard, and respectfully treated. So our goals for the project that we are going to be talking to you about today is to improve postpartum care, support, and equity across North Carolina by co-designing tools and resources for providers and families and putting them into daily practice and use. And this is really important for so many reasons. Most importantly, currently, this reminds us that not doing the work of improving postpartum care can have very significant consequences. Maternal mortality rates in the United States have increased 40% in 2021. So our health crisis, as you can see by the figure on the screen in front of you, is getting significantly worse over time. This is a trend that none of us in medicine or public health ever want to see, and it requires urgent and immediate intervention. It's important to note that this crisis doesn't affect everyone the same way. Black women in the United States and in North Carolina have significantly higher risks for maternal mortality than white and Hispanic women. And even more important, we know that 84% of pregnancy-related deaths in the US were preventable. So by working together, we can turn these numbers around. The significance of the postpartum period has long been overlooked, and we are excited that many people, including yourselves, are interested in thinking about what we can do to make care better. And this shows the role that care after birth plays, where more than half of pregnancy-related maternal deaths occur after delivery. And there's so much work to be done in this space. These are just a few quotes from women, new moms that we have talked to over time that describe the challenges that they've had in accessing self-care and postpartum health-related information. For example, someone said, "I searched for help, but got no answers." Someone else noted that when I had my babies, no one had answers for me. I felt very alone. Another mom said, "Sadly, I was only given information because I knew what questions to initiate myself." And we heard from another mom, "There were not any formal places for information about what to expect during recovery from a maternal near-death event." Those quotes were symbolic of what we've heard from lots of moms, and in part what led us to create NewMomHealth.com and saludmadre.com, which is in Spanish. So this is a resource that is open and available for all new parents in North Carolina and across the country and world. And there are resources that we're going to be talking about today that are available at NewMomHealth.com. You can look at the top of the website navigation bar and you'll see something that says for providers, and you can find those resources there.
All right, so going along with that, I'm very excited to introduce you to our Postpartum Toolkit. So these tools are clinically developed and they're free to order and use. They have also been translated into Spanish so that we can accommodate more families. And here you can see a list of all the different printable resources, and I'm going to go more into depth into what each one is and how you can think about incorporating it into your setting. So our one-pagers for new parents and baby are kind of like our workhorse tools. They are very popular because it is concise and goes over when you need to call 911, when you need to call your healthcare provider, and then also gives some general tips on how to care for yourself and baby. So this tool can really be distributed anytime in the 3rd trimester. It can be done at discharge teaching at the hospital, and even all the way into the first few weeks of the postpartum period. So people liked our one-pagers with the warning signs so much that they wanted something developed that just highlighted the warning signs to look out for in mom. So we have this one coming soon. It's a one-page handout that is available that will go over the emergent and urgent signs to watch out for. And then on the flip side of the same sheet, there is some general information about our website, NewMomHealth.com, and then the Spanish sister site, saludmadre.com. And again, these are really great to give out in the last trimester as mom approaches delivery and anytime up until the first few weeks in the postpartum period. Because our warning sign tool was so popular, we actually turned them into video reels. So these are perfect for if you have some screens in your waiting room where you want to play these on, as well as if you work with parents who prefer learning from watching a video as opposed to reading a handout. So feel free to reach out to us if you want to access these video files. The next tool is the Postpartum Care Plan. So this one is meant to be filled out by both the provider and the patient working together. It has spots to put clinically relevant information, such as the contact information of their providers, their next appointments, medications, as well as places to put in information related to resources for things like food, childcare, transportation, diapers, and WIC. This tool should be introduced sometime in the 3rd trimester to help the patient get prepared for the postpartum period. The Postpartum Plan is our next tool, and it's a little different from the Postpartum Care Plan in that this is meant for the patient to fill out herself and to use as a guide to think about preparing for the postpartum period and how she would like others to support her. She can share this with those who plan to offer help during the postpartum period. This should be given to the patient sometime in the 3rd trimester. Our next tool is the postpartum visit checklist. So this is designed to help guide conversation during the postpartum visit. Ideally, it can be given to the patient before she comes in for her postpartum visit so that she has some time to look through it beforehand. However, we know many times this is not feasible, so the best way that this can be used would be to give it out to patients when they check in for their postpartum visit. And while they're waiting, they can look down the list and check off the topics that they would like to discuss during that visit. The Taking Care of You booklet is a comprehensive 30+ page booklet that covers much of the content found on NewMomHealth website. You can see some of the topics listed here, and a good time to introduce this one might be during the 28-week visit when patients are at clinic for an extended period of time during their glucose screening. Our next tool is the Birth Control After Baby booklet, and this is also another really comprehensive tool with 30+ pages that covers topics related to sex, contraception, and family planning. Even though it talks about birth control after baby, a good time to introduce this is sometime in the 3rd trimester, so the patient has time to consider her options. You may also want to introduce this during the 28-week visit as well, since it covers a lot of information. So I know that was a lot of tools that we just went over, but we are here to support you. So there are several ways that we can do that. We can meet with your team to discuss the different materials and which ones might best fit the work that you do. We will also go over how to order these materials, which can be printed and shipped free of charge to you. Technical assistance meetings can help your site figure out the best way to incorporate some of these tools into your workflow. And then we also offer monthly community of practice webinars on different topics to improve postpartum care and services. And listed here in the bottom, you can just see a variety of the topics that we have discussed in the past. So our community of practice webinars are meant to be helpful to you all. So we are always open to topics or speaker suggestions. If you have anything that you would like us to see us talk about, you can email our team member, Suzanne, and her email is listed right here. We also have a listserv that you can join to stay up to date on new products, research, and events related to North Carolina's maternal mental health care. And then we are also active on various social media sites as well. If you'd like to meet with us to discuss anything, we offer quarterly team meetings as well as per request availability. And then let me turn it back over to Sarah to finish up the presentation.
Well, we hope that there was something you saw in the set of tools that is really interesting to you that you might consider adding to your practice. Just here's some additional information and a reminder about how you can subscribe to our listserv and follow us on YouTube and Instagram. The QRC code is right on the screen if you want to grab that on your phone really quickly. We appreciate you listening. We really look forward to hearing from you. Please reach out to Rachel. Her email is on the screen. And we look forward to working with you together to improve postpartum care and the way that America treats new moms. Thank you.